Hi and a very good morning to everybody. I'm Linda Marshall and I would like to present about fungal infection and antifungal drugs. But before I start, I would like to thank my lecturer Sir Neo for giving me this opportunity to present here. I'll start by explaining the definition of fungal infection. Fungal infections are common throughout much of the natural world. In humans, fungal infection occurs when an invading fungus takes over an area of the body and is too much for the immune system to handle. Fungi can live in water, soil, air, and plants. There are also fungi that live naturally in the human body. Like many microbes, they are helpful fungi and harmful fungi. When harmful fungi invades the body, they can be difficult to kill as they can survive in the environment and reinfect the person who tries to get better. The common fungal symptoms are skin changes like cracking or peeling skin and itching. Common fungal infection including ringworm, jock itch, athlete's foot, snail infection, and yeast infection. The first one is athlete's foot. Athlete's foot is also known as tinea pedis. It is a common fungal infection that affects the foot. Athlete's foot is commonly associated with spots and athlete because the fungus grows perfectly in warm, moist environments such as socks and shoe, sport equipment, and locker room. In reality, anyone may be affected by athlete's foot. It is common in warmer climates and summer months, which it can be quickly multiply. The symptoms are redness or blister on the affected area, peeling or cracking skin. The skin may scale and peel away, itching, stinging, or burning sensation in the affected area. Athlete's foot is often treated with topical antifungal ointment, which are available to purchase over the counter in all pharmacies. Severe infection can require additional oral medication as well. The feet will also need to be cared for and kept dry to help kill the fungus. In order to prevent athlete's foot, the feet must have plenty of air to breathe and keep them clean and dry. It's also a very good idea to wear sandals in public shower or locker rooms. The second infection is yeast infection. Yeast infection is also known as vaginal yeast infection. It is a common form of Candida overgrowth in women, usually caused by Candida albicans. An overgrowth of Candida disrupts the normal balance of the bacteria and yeast in the vagina. This imbalance of bacteria may be due to antibiotic stress and hormone imbalance. Candida infection can also commonly cause fungal toenail infection and diaper rash. So the symptoms of yeast infections are itching and swelling around the vagina, burning sensation or pain during urinary, redness and soreness on the surrounding of vagina, and unusual vaginal discharge. A rash may develop over time in some cases. Yeast infection should be treated quickly as the symptoms may be severe if left untreated. The treatment of yeast infection depends on their severity. Standard treatments include creams, tablets, or suppository, which are available via prescription or over the counter. In order to avoid yeast infection, it must begin with a balanced diet and proper hygiene. Wearing loose-fitting clothing made from natural fibers may also help prevent infection. Washing underwear in very hot water and changing feminine products often can also help to prevent fungal growth. The third fungal infection is jock itch. Jock itch is also known as tinea curis. It is a common fungal infection. These fungi love warm and damp environments and thrive in moist area of the body such as groin, buttocks and inner thigh. Jock itch may be more common in summer or in warm humid area of the world. Jock itch is mildly contagious and is often spread through direct contact with an infected person or an object that is carrying the fungus. The symptoms including redness in the groin, buttocks or thigh, a red rash with a circular shape and raised edges, and cracking or dry peeling of the skin in the infected area. Treating jock itch usually involves topical antifungal ointments and proper hygiene. Many cases of jock itch are improved by over-the-counter medication. Thinning the affected area and keeping it dry can also help to kill the fungus. Next will be ringworm. Ringworm is also known as tinea corporis. Tinea corporis is a skin infection caused by a fungus that lives on dead tissue, such as skin, hair, and nails. When it appears anywhere else on the body, the infection is called ringworm. Ringworm is usually easy to notice because of its shape. The outside of this ring is red and may appear raised or bumpy, while the inside of the ring will remain clear and become scaly. Ringworm is highly contagious and it can be transmitted by skin-to-skin contact or from contact with pets such as dogs. The fungus may also survive on objects such as towel, clothes, and brushes. The ringworm fungus also infects soil and mud. So people who play or work in infected dirt may catch ringworm as well. Creams and medicated ointments are often sufficient to treat many cases of ringworm, and it can be purchased over the counter. Ringworm of the scalp or severe ringworm may require a prescription from the doctor. Basic hygiene can help treat and prevent ringworm as well. Keeping the skin clean and dry can help avoid infection. Last but not least will be toenail fungus. Toenail fungus is also known as onychomycosis. It is a common type of fungal infection that can affect toenails, fingernails, and nail beds. It's also known as tinea unguim. The symptoms of toenail fungus usually start as a small light color spot on the nail. As it spreads deeper and it changes the shape and color of the nail. Over time, it can cause the nail to become thicker and more brittle. It can potentially take weeks to treat fingernail infection and months to treat toenails infection. Over-the-counter medication typically aren't effective enough. Doctor may prescribe a nail lacquer that brushes on like nail polish or an antibiotic that must be taken by mouth. Since this is a type of infection can be so hard to treat, it is important to avoid spreading it. And that's all from me. Thank you so much for listening. Thank you. Bye-bye.